the Rogers TV viewer response line, email us, or connect with us on social media. Due to the length of the preceding program, we now join the regularly scheduled program already in progress.
Anytime we identify an issue in public health as a problem, I really see the opportunity. I see it as a way how we can improve this, how we can enhance it, turn it into success. And during the pandemic, there was, as a background to the change that happened, during the pandemic, many changes happened, many policies changed, and the access to testing of private well water and the testing that was in place was provincial, continues to be the provincial lab, Public Health Ontario lab that provide this testing and a courier to collect the samples. The change was in the access. Many of the access points have been restricted by policies, and we had to come up with an alternative at the time during the pandemic, during the emergency. We worked with grocery stores because they stayed as essential services, and Andy and his team managed to find locations that would serve the bulk of Grey Bruce or all Grey Bruce, but in the most acceptable way at the time. Somebody might have to travel for an hour to get to the testing center. After the pandemic, it seems there has been pressures on the provincial program to be able to deliver the old sites that were in place. And that's for many reasons. Some of them are local, some of them provincial. So at that point, we identified the issue as an issue that needs improvement for the permanent way. And we stepped in, we took owner of the issue, of the problem. It's not a mandate for the health unit, but again, the health of the public would allow us to step in. And we identified a number of ways to ensure an appropriate solution is implemented. And we created a route in Grey, route in Bruce to be covered on weekly basis, and to ensure that everybody in Grey Bruce would have access to testing of well water within, our aim is within 20 minutes. But again, we always under promise and hope to over deliver instead of the opposite. So we planned it and announced it for 30 minutes, but I'll be interested actually in the feedback from the public and if it is within 30 minutes or less, or within 20 minutes or less. And I'll turn it to Andy to provide the mechanics of the program, and a lot of work has been done in it.
Thank you. Yeah, just to reiterate, obviously, we know within Grey Bruce that quite a high proportion of residents are on private water, and perhaps we'll come back to that a little bit later, Carol, as to why this process is important. But we consistently got feedback from people over the years that the locality of a drop-off point is really important to people as to how they use this service. So that's 20 minutes, or we are with a couple of exceptions. There's very few areas within Grey Bruce now that's more than 20 kilometers away from the local drop-off point, with the 14 different locations. So yeah, certainly there was some logistics. Public Health Ontario, continues to be a key partner. Obviously, we have to make our system jibe with theirs, because ultimately these samples have to go down to the PHO lab in London, and that needs working with their courier as well as ours. Other really important partners, though, in the area, obviously the municipalities. So we, in all those different locations now, working with the municipality, and in some cases with some other groups as well, to have those locations and to make sure that they work. And then, of course, our local courier as well. And yes, there's certainly a lot of logistics around timing, around the equipment, around the sort of return of equipment back from London so that we can do the loop each time. But essentially, that has fallen into place quite well. We're into our third week now of this new system. And of course, you always have a few teething problems in the first week, but really nothing too challenging. And we've all worked together, the different partners, so that I think we're approaching a system now that is working as we'd envisioned it.
So do you mind if I call you Andy, or do you Is that okay?
That's fine. Yes.
I know. So what I'd like to do, Andy, is just ask you, for the audience that's watching and listening today, they may be saying, well, gee, where are the locations? And, you know, I understand that there is a sensitive timing around the drop off to be able to get it tested and back in time. Can you speak a little bit about where people can get the information?
Yeah, so the best way to get that information is our website. It's all new content there. We have an interactive map which shows you exactly where the locations are, and you can hover over those little pins and they will tell you the address and the timing of each of those locations. Obviously, if you don't have access to a computer, if that's not your thing, then certainly anyone can phone in. We have an info line, the business hours, and the person that answers the phone there can give that same information by phone as well.
So well water testing is free to the public, correct?
Correct.
But there's a timing about the dropping off of the samples and when they have to be tested. Can you speak a bit about that and why that's so important?
Yeah, so it's important. Well, the bottom line, it's important because otherwise the sample will be rejected by the lab. The lab obviously has to follow accredited standards, and the water arriving there has to be with sort of fresh, essentially, within a certain time frame. So what that means is that the public dropping off the sample, if they take the sample at home and then take it to the location the morning of, then that is 100% on it in every occasion. That's going to be good when it gets to the lab.
Yeah.
For some people, though, that's not practical. Some of our drop-off times are quite early in the morning.
Mm-hmm.
So it's also important to note that, again, if you take the sample at the tap, fill out the paperwork, and get it to that location the afternoon of the day before pickup, then that is also okay. That means it's going to get to the lab on time. What doesn't work is if you get the wrong day, or if you take it sort of a couple of days before, even if you've kept it in the fridge, which is an important step, then it will be timed out essentially when it gets to the lab.
Yeah. And I note because I do have the print off of the locations and the timing. So my understanding is there are Monday to Friday pickups in certain locations, and then Wednesdays in certain locations, but certainly not Saturdays and Sundays.
Correct, right. So we have 5 days a week pickup for Bruce County, that's in Warburton, and for Grey County, that's in Owen Sound. So that continues to be 5 days a week, not including statutory days. Then the new part of the system is what we've introduced, so that Wednesdays we have a route all the way through Bruce County. So that includes Kincardine, Port Elgin, North Bruce Peninsula, Wyerton, Chesley, and as I say, Warburton's 5 days a week. And then on Fridays, a similar sort of process with a loop around Grey County, which includes Hanover, Chatsworth, Meaford, Town of Blue Mountains, Durham, Markdale, and Southgate. So again, those locations deliberately working with municipalities to ensure that we've got as much kind of even spread of those locations as we can manage.
Excellent. Dr. Era, I'm going to come back to you, but Andy, you stay there because I have more questions for you. One of the strengths I've noticed, certainly over COVID and even before, is the strength of the partnerships that public health has throughout Grey Bruce. And I'm wondering if you could speak a little bit about the collaboration and what you had to do as the medical officer of health to bring this forward and be able to bring it to all of the municipalities.
Yeah, definitely. That's not a subtle point. The success of Grey Bruce in managing the pandemic locally, it lends itself directly to the collaboration. The Grey Bruce health team, or the Grey Bruce team in general, like every sector, whether it is municipalities, whether it is schools, healthcare, you name it, everybody came together. Private and public sectors alike contributed. And that is, in general, the work of public health. We usually ensure things are done through mobilizing the community. This is the ultimate way to do things. You can invest money in a clinic or in a organization, but that's going to continue, and that's going to enable the community not to be dependent on it. If you mobilize a community, especially for public health causes, they usually are multifactorial. It's not just the work of the physician or the nurse. So in Grey Bruce, again, I hope we're not sounding immodest, but we had 0 death in long-term care in 2020 and in 2021 before Omicron. It was only end of December 21 when Omicron hit. Then, the mechanics change, and it's a different situation. But for 2 years, when the rest of the province, the main problem was death in long-term care, we had maintained the 0 death. And obviously, the virus doesn't have boundaries. We were hit with the Delta variant. We were a hotspot for only less than 6 weeks. So it's not we're protected because we're rural. Yeah. The province universally had to deal with death in long-term care, something that's very, very, very difficult for communities, for families. And due to that collaboration you just referenced, we had 0 for 2 years. And again, public health does work in the background to bring the community together. And back to the subject at hand, this program, can we fund it and run it by the health unit? Yes, we would, but it's not going to be as responsive to the local need. Working with all municipalities, having municipal offices, we know that this is the ultimate location, or whatever location chosen by that municipality, that's ultimate for their community. People are comfortable going there. People know what's going on. And more importantly, the feedback. We always evaluate. So this program might morph. And we always have the principle of the least intrusive, the most access to the public, based on the feedback we receive from the public, from the partners, in this case, the municipalities.
So certainly the strong partnerships that were enhanced through, unfortunately, the circumstances of the pandemic created that framework for you to continue with other programming, correct?
Most certainly, yes, absolutely.
So I have a question, because you sent me this question about the challenges and the opportunities that you've encountered since launching the new system, and how you plan to address any challenges. And I know you mentioned, it's a fluid process, like water is a fluid substance. But moving forward, what have you found so far? And I know it's early days, but what have you found so far? And what have you done to address it? And what do you think you might have to do to tweak things? Who wants to answer that? Is that back to Andy?
I presume so. I can see him eager to jump on it.
I think certainly one of the challenges that we knew that we would have was around communication. This is something that is a service that many people have used for years. And when you make a change like this, a change to the location, a change to the day, it changes people's routines. And our communications folks, I think, have done a really good job with that in terms of the media releases that have gone out, the refresh of the website, and and really, again, working through those partners. We had signage at the previous locations before the change was made. So various things have been done. Of course, we know, though, it is still a change. And so I think part of the evaluation we'll be conducting is based on people's feedback. We've had positive feedback. We've had some less positive as well. And again, I think some of that reflects either the change in location, or in some cases, because those county locations are 1 day a week, then perhaps if it worked better for them to do it on a different day, then we knew that was always going to be a limiting factor. So I think any evaluation that we get from people, we obviously will hear them and we'll listen to that. and we'll see what we can do to improve the service. It obviously, a big point of this was to make it equitable, and we wanted to ensure that we had those locations close by. So I think that that will continue to be a focus for us. It obviously, we have to be able to make it work from a logistics and a financial point of view as well. So, it's a big area, Graham Bruce, and we have to be realistic about what sort of service level we can provide. But certainly, if we can make tweaks, if we can make improvements going forward, then absolutely we will do that.
Yeah. So measuring the success of the program, this is an assumption on my part, but are you hoping that there will be more uptake on testing and samples because it's not just more equitable, but perhaps closer to home?
Yeah, that's the hope. Now, obviously, that's the sort of that will be more long-term evaluation, but we certainly, the residents of Graham Bruce did a good job in terms of testing their water systems. We'd still like to see more people do that at the sort of at the rate that we would advise. So there's room for people to do more, but we have really good uptake of this service. And if you look at the numbers that we going back to say 2019 prior to the pandemic, I think that our goal ultimately is to get back to those same sorts of levels. And if we can exceed them even, then that would be fantastic.
So just refresh my memory around the timing for well water samples or how often, just to encourage people to take the samples. What is the recommendation for the guideline?
Yeah, so once people have a little bit of a history and they know that generally their water system is providing them safe water, then we would advise 3 times a year is ideal. I would absolutely advise anybody to take one during that sort of spring period. So, we start to get snow melt, you start to get those heavy rains, blood flies flooding. That's a really good time to take a water sample. And likewise, the ground conditions can change and be very different sort of late summer into the fall. So that's a really good time to take one as well. And yes, ideally, if you can do a third one at some other point in there, that would be ideal too. And of course, what we're looking really is anybody on a well, on some sort of private water system. People on municipal systems don't need to worry. There's trained staff doing all of this for them. But if you're looking after your own system, then really ultimately, regardless of what sort of filtration you might have in place, it's these tests that make sure everything is working and that you're providing safe water for your family.
Yes. Dr. Era, do you have anything to add to that or any comments?
Yeah, if I may, the evaluation part, the number of tests that have been done historically is one of the indicators. We can also look at the data based on the geography. If there are any areas in Grey Bruce that's underperforming and then we would explore the reasons. Is it the access? Is it the knowledge? Then we can design communication to that group. And depending on the scenario, there are many ways actually to use data to optimize the uptake. And like Andy mentioned, the timing in the year, are people testing in the spring? And again, there's plenty of information on our website. I want to promote our website here just because it's a gateway for people if they spend half an hour on flipping the pages, especially if they're using their own private well and they're managing it themselves, not a company. So again, there are plenty of information there and knowledge. And related to the testing, the frequency, like Andy mentioned, 3 times a year, and depending on specific scenarios, sometimes people might open a tab and run the well empty, and in that case, they need to manage that well, and they can test it for a couple times in the following weeks. And there are a lot of interesting information on our website, and as a person who moved from using municipal water to a private well, I find it fascinating how much there are things to pay attention to, especially if somebody's managing it themselves. So again, we encourage people to look at that our website for a few minutes a week or so. It would take half an hour to read it, and hopefully it will be useful.
That's interesting that you comment that you also have to pay attention when you've gone from municipal to well water. So it applies to everyone. That's equitable, right?
Absolutely, and honestly, I have way more appreciation. I had it for a long time, obviously, but when I went into public health to know what the mechanics of the system and the private well itself and the municipal system, then you look at the bigger system, how to test and deal with it. There's a lot of things that goes behind the scene. And again, many people take it for granted. They go to the tap, open it, and drink water, but I don't. I really don't take it for granted. Many people in the municipalities, obviously, they're taking responsibility of very important component of our life, which is safe drinking water.
That is so true. I wanted to chat a bit about the supply chain. One of the things we all became aware of, and again, not to necessarily reference the pandemic, but it was certainly a significant event and a learning for many, many of us, was about supply chain issues and what happens when supply chains aren't working for a variety of reasons. So couriers, you use couriers now around the pickup, and that's a supply chain, right? You have to have those services. So how did you go about getting the couriers that would be able to, drop off, pick up, whatever?
I mean, in terms of the logistics of getting that, obviously that was a case of looking for local businesses and going through the sort of purchase or requisition process. So it'll be the same as other contracts and things. There are obviously that's the personnel, or that's sort of a key part to it. But there are also sort of traditional supply chain components to this as well, in that you need to have the coolers and the ice blocks in the right places at the right times. You need to have the bottles available for people, and anyone who's done water testing in Grey Bruce, particularly in summer, knows that can be a challenge at times. That's something that, believe it or not, those are actually assembled in Toronto, and then there's a supply chain to get those to London Public Health Lab, and then from London into Grey Bruce. So something that seems pretty simple, well, you should surely, it's just an empty bottle. But actually there's quite a lot in the background. And in that case, it's quite a restricted supply chain. So we always do struggle, even if we get ahead of the curve a little bit before the summer, to keep up with demand. And we have to remember, of course, in the summer, it's not just our permanent residents, it's also our seasonal residents that will be using services like this. And that means the demand for these things go up quite significantly.
Now, public health also provides the education. Should a sample come back and there needs to be something done, we've got about 3 minutes left in the program. I think it's important to encourage people, even if they're concerned, to recognize public health has that support and education function. Who'd like to speak to that in the 3 minutes we have left or less?
Please go ahead, Andy.
Yeah, so just perhaps in the details a little bit, then again, we have our info line. If you call that, you're talking to a real PHI in Grey Bruce. This is a sort of, a local service that we have, and those people can help you through your problem, help you understand your system, whether it's just you've got a total coliform of a couple and you just want to know whether there's anything you can do, or whether you've got significant high E. coli and total coliform counts, and maybe there's some sort of event that's really impacted on the system. So they can help you sort of understand that. And certainly, forms an important part of that public health education.
Yeah. Dr. Era, I recognize that you said at the very early part of the program, this is not necessarily the mandate of the public health here in Grey Bruce, but I think it's remarkable that you've risen to the challenge of trying to make equitable access to well water testing. I mean, that in itself is I think, really significant. So the last minute is yours.
Thank you. Definitely, the importance of safe drinking water is something that's not subtle, and especially in our area with the history of the emergency in Walkerton. And the health unit definitely stepped in and worked with the municipality to put this program. This program would be more complete when people utilize it. And our audience, whether they are on private well or not, they can learn about this. They can pass it to their kids or grandkids, whomever is dealing with this, and provide the information that there is this program. And it will go a long way that we put our shoulders, all of us, towards it. At the end of the day, we're using the same healthcare system. Any unfortunate water contamination or illness would affect the community, would affect families, would affect all of us. And I really want to thank our partners, the municipalities and the media locally to communicate this. Yourself, obviously, in this session is helping ensure the health of people in Grey Bruce is promoted and protected. Thank you so much.
So safe drinking water means getting it tested frequently, and also safe drinking water saves lives. Thank you to both of you for being here on the program today. This has been great, and I look forward to hearing more as you go through this process about the uptake and the testing and things that you're doing as well. So please stay tuned, and thank you to our viewing audience as well for joining us today. Please join us again to learn more about health services and programs available to you and your family in your community. Take care.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
Hi, I'm David Sherman, host of Politically Speaking. Join me for my next show where my guests will be from the Blue Water District School Board. Politically Speaking on Rogers TV.
This is a man's heart, a heart in desperate need of medical attention. But because 78% of Indigenous people experience racism in healthcare, he may not get the help he needs.